Hi, I'm Dr. Eric Arzubi. I'm board certified child and adolescent psychiatrist, and I'm CEO of Frontier Psychiatry based here in Billings, Montana. So today we're going to talk about ADHD in children and how to tell it apart from other diagnoses. So, as you probably know, diagnoses in children and in adults for that matter, when it comes to mental health, often travel together. Um, but it's important to be able to pull apart the symptoms when you're trying to figure out if somebody has primary ADHD plus or minus any other diagnoses, right? So, and forgive me, I'll be just taking a peek at my notes here as we're talking. But first, right, in terms of understanding ADHD, it's a neurodevelopmental disorder, and it involves persistent patterns of inattention, hyperactivity, and impulsivity that by definition, have to interfere with daily functioning. Um, and the symptoms have to be present in more than one setting. So typically for children, right, it's home and school, and these symptoms have to begin before the age of 12. Now, the core symptoms of ADHD, again, inattention, hyperactivity, and impulsivity. Those are the core symptoms, and let's go through each one. So inattention is difficulty sustaining attention, making careless mistakes, not listening, having trouble organizing tasks, losing things, getting easily distracted, and being forgetful in your daily activities. Hyperactivity includes fidgeting, inability to stay seated, running or climbing in inappropriate situations, talking excessively, and feeling like that person's always on the go. And then finally, impulsivity, like blurting out answers when it's not appropriate, difficulty waiting. The child has difficulty waiting his or her turn, and interrupting or intruding on other people. So, in order to diagnose ADHD, what do? Well, you gather information from parents, teachers, and caregivers, right? So you want to collect information from people who know the child in more than one setting, and you can use standardized rating scales, and the most commonly used ones include the Vanderbilt and the Conners. And like I was mentioning before, you want to make sure those symptoms are actually present in at least two settings and cause significant impairment, right? So if you have somebody with inattention, but it doesn't cause any problems, then it's not a diagnosis. And then you also want to rule out other diagnoses, including medical problems, developmental problems, and you want to make sure, when possible, to get an educational assessment. One of the things that's not often appreciated is that 50% of children with ADHD also have a learning disability. So, unfortunately, accessing educational assessments is pretty difficult. But when possible, it really makes sense to rule out a learning disability, particularly reading disabilities. So there are other conditions that can mimic or overlap with ADHD, right? So you either have, right, and when you're thinking about the diagnosis, you either have it, the person either has ADHD or doesn't, or that person could have ADHD plus something else, right? So it takes a little bit of time to kind of figure this out, but here's some tips on how to understand when things overlap and how to tease apart a separate diagnosis. So, for example, anxiety disorders, right? Anxiety disorders can show up and look like right, and anxiety can cause inattention. It can cause restlessness. But to understand if the person has anxiety or ADHD, what distinguishes anxiety, right, is constant worry. It includes physical complaints in the child, and symptoms worsen during stressful times. So again, important to tease that apart. How about depressive disorders or depression, right? Kids with depression can have inattention and low motivation. Now, remember, one of the diagnostic criteria of depression is actually poor concentration. So, what else do you need in order to diagnose depression? Well, persistent sadness, feelings of withdrawal, and changes in sleep and changes in appetite. Um, Next, learning disabilities. Like I said before, 50% of children with ADHD have learning disabilities. So, the core symptom that sometimes overlaps with ADHD is struggling in school, right? Now, to pull apart a learning disability from ADHD, a learning disability will actually be related to specific difficulties related to reading, writing, or math, right? So reading disability is dyslexia. Math disability is dyscalculia, and dysgraphia is a writing disability. So those are important to keep in mind. Sometimes somebody with an autism spectrum disorder can mimic ADHD, especially when it comes to inattention or hyperactivity. So again, to pull apart autism spectrum disorder as a diagnosis, you want to see if there's social disengagement, if there's repetitive behaviors, and there are communication issues. So these are three things that would set autism spectrum disorder apart from ADHD. Next, sleep disorders, right? Somebody struggles to sleep, that person's going to have a hard time concentrating and focusing. So again, a sleep disorder will often be accompanied by inattention and hyperactivity. But other problems related to sleep include snoring, restless sleep, and daytime fatigue. And then finally, oppositional defiant disorder. So oppositional defiant disorder can include impulsivity and behavioral issues that sometimes overlap with ADHD. But the other thing you need to have in order to diagnose ODD or oppositional defiant disorder is persistent anger, defiance that's not limited to attention problems. So again, those are separate from ADHD. And then next, ruling out hearing and vision problems, right? If somebody has a difficult time hearing or reading, there will often be inattention associated with that. So obviously you want to do some screening and testing, and the distinguishing characteristics of a hearing or vision disability or problem include failure to respond to auditory cues or visual cues, and you want to confirm that with testing. So again, what are the keys here? In order to differentiate ADHD from other diagnoses, you want to make sure that you have a comprehensive history, reviewing developmental, medical, and family history, and you want to ask about prenatal exposures to toxins or substances, also looking at head injuries, a history of head injuries, and sleep patterns. Number two, symptom context. In what context are these symptoms happening? So are they present in more than just one setting or one setting alone? Obviously for ADHD, you want to have symptoms in both settings. Have you done a developmental assessment? Sometimes problems with inattention and hyperactivity are actually age appropriate, especially in younger children. So again, we want to make sure that normal things are considered normal and we're not diagnosing based on what's really just a developmental milestone. Next, use rating scales. Use ADHD specific rating scales like the Vanderbilt or the Conners, but don't rely on them only for diagnosis. They're rating scales, they're not diagnostic tools. So use them to help you collect information and then look at the big picture. Next, you want to rule out other causes, right? So we just went through the list to make sure you're ruling out anxiety, depression, learning disabilities, autism spectrum disorders, and medical conditions like hearing loss or vision problems. Next, you want to make sure there's actually an impact on the child's functioning, either at home or at school, or typically both, right? So symptoms must cause significant impairment in social, academic, or occupational functioning. So they need to happen in two settings or more. And then finally, consultation. When in doubt, you want to consult with a specialist such as child psychologists, psychiatrists, or developmental pediatricians. But an important point here is you don't need to do a full battery of neuropsychological testing to diagnose ADHD. The testing, or specifically educational testing, will be critical when it comes to trying to untangle a learning disability from the picture, either to make sure you're ruling that in or out, or it's kind of combined with your ADHD diagnosis. Anyway, I hope this has been helpful. Please continue to follow us here for more educational videos, but good luck to you. And as always, reach out if you need any of our help or support.